Hi, it's Tatito on Health. Today we'll be having a discussion on hyperprolactinemia. I choose this topic because I'm into fertility brands, and oftentimes I come across young women, um, young women that has this hyperprolactinemia, and leads to infertility. And you and I know that infertility is a major concern when it comes to a woman's life. So we'll be having the discussion on hyperprolactinemia. I hope you find this video educative, and thank you for joining my channel today. Okay, so back to our discussion: hyperprolactinemia. Hyperprolactinemia is an abnormal increase of the hormone prolactin in the blood. Or you may want to ask me, what is prolactin? In as much as I'll be using some medical terms in this video, I will also be breaking these medical terms down to every common, to everyday language, where you'll be able to understand what I meant by those terminologies, and for you to get more understanding on what I'm saying, because the purpose of this video is to educate you, for you to know what hyperprolactinemia is all about, the symptoms to look out for, and when it's the red alert for you to call on the doctor. Okay, so like I said before, hyperprolactinemia is an abnormal increase of the hormone prolactin in the blood. Hormone prolactin is what is responsible for breast production, for breast growth, and for breast milk production. So this hormone prolactin is actually what is responsible for what we also call feel good. Yeah, it's also responsible for it. It's being controlled by dopamine and the thalamus, and it's controlled by dopamine. It's in the thalamus in the brain. Okay, so back to our prolactin. Prolactin is the hormone that is responsible for breast growth, breast production, and breast milk production. So, hyperprolactinemia. What are the possible things that can cause this hyperprolactinemia? We have some things like breast stimulation. You're not pregnant, you just feel like playing with your stimulating your breast. Of course, there are some that, as a result of the high increase in the system, during the process of that breast stimulation, it can breast milk can occur, can discharge from the breast, and is as a result of this hyperprolactinemia in the system. And also we have something like some antipsychotic drug. Yes, antipsychotic drug that can lead to this hyperprolactinemia in the system. Also, we have excessive exercise, excessive stress can lead to this hyperprolactinemia in the system. Okay, so now I'll discuss about, let's discuss about symptoms. This hyperprolactinemia, what does it cause? Does it have any damage to the body? Does it cause is there any cause for alarm? Okay, so these are symptoms that you look out for this hyperprolactinemia, for you to know that you have hyperprolactinemia. And medically, before I discuss about the symptoms, medically, for you to know you have hyperprolactinemia, there's a test. If you're already having the symptoms, then there's this test that you will do after discussing with your doctor. There's this test that you will do, which is called hormone profile. Yes, hormonal profile. Hormonal profile assay. That is what you will do for you to really confirm that you're having this hyperprolactinemia. So back to our symptoms of hyperprolactinemia. We have what is called galactorrhea. Galactorrhea is a spontaneous discharge of breast milk without breastfeeding. In other words, a situation whereby your breast is bringing discharge of breast milk, and it is not that you are pregnant, it is not you have a baby. Like we know that this period WHO encourage exclusive breastfeeding. So this hormone prolactin is what is actually responsible for that production of breast milk for you to give to your child for exclusive breastfeeding. But in a situation whereby you're not breastfeeding, you don't have a baby, you're not pregnant, and yet your breast is leaking, then you should know that there's an issue there. You should know that probably something must have gone wrong with my prolactin level. Probably my prolactin level might have increased. That is what is causing the spontaneous discharge of breast milk that is I'm experiencing. Then another thing is that this hyperprolactinemia, and now before I forget, this hyperprolactinemia, it does not only affect female, it also affects male. In other words, male can have hyperprolactinemia, female can have hyperprolactinemia, but just that it is common among female of childbearing age, and that is what situation whereby, and oftentimes it is when you get to that childbearing age that you begin to take some issues serious. It is that time you begin to notice your body. Why? Because you felt it's normal for me to conceive. Now that I am ready, now that I'm well prepared to have a child, so it is normal for me to conceive. And a situation whereby between a period of a year you're unable to conceive, then you begin to take note of your body system. You begin to check, and there's possibility that you might have been experiencing this, but you didn't take note because you're not ready to conceive. You're not in marriage. You're not even ready. So as a result of that, you didn't take this body changes serious. But in a situation whereby you finally ready, made up your decision to have a child, and you begin to take notice of your body, it is that time you now notice that it's like my breast is leaking, it's like my menses is not coming regularly. Then you now begin to know that, okay, so that is why I said it is common among women of childbearing age. So another symptoms for you to look out for when it comes to hyperprolactinemia is amenorrhea. Amenorrhea is irregular menses. In other words, today you menstruate, this month you menstruated, normal, maybe normally your days of menstruation should be 5 days, and instead of him to come for 5 days, you saw it for 3 days, and also instead of you to see it in another next month, you didn't see it in the next month, or you saw it twice within a month. You saw it twice within a month, that is for 3 days for this week, then maybe next 2 weeks it came again for 5 days. So that's to tell you that there's something wrong with your prolactin level, and to tell you that you need to see your doctor. Another major thing that this hyperprolactinemia can cause is infertility. Infertility for both male and female. A situation whereby whether be a male or a female is unable to conceive for a period of a year after having sexual intercourse with his or her partner. So in other words, this hyperprolactinemia can also lead to what we call infertility. And this infertility, we have primary infertility, a situation whereby you don't have a child, you've never given birth before, you've never conceived before. And we have secondary infertility, a situation whereby you have a child or two before, and all of a sudden after many years you couldn't conceive again. So this hyperprolactinemia can lead to what we call infertility. And for male, it can lead to erectile dysfunction, it can lead to oligospermia, it can lead to azoospermia. Those are ailments that this hyperprolactinemia can cause to the body system. But in as much as this hyperprolactinemia should be a major concern if you are experiencing any of the symptoms I earlier mentioned. The good part is that there are trusted treatment option that is available. That is, if you have any of these symptoms, go to your doctor. They'll be able to discuss with you what type of treatment that will best. Your doctor will need to run a test to be able to confirm it's causing your infertility or because we have so many other issues can lead to infertility. Hyperprolactinemia is just one out of many other issues that can lead to infertility. So briefly I will talk about some drugs that are very good, that are okay for you to take when you have some drugs that are very good, that are okay for you to take when you have hyperprolactinemia. We have what is called bromegol or bromocriptine. Okay, the popular name is bromocriptine. This bromocriptine is effective, it's okay, but just that the side effect is crazy. There's some persons that can tolerate it. There's some that they cannot even tolerate it, and that is why we have another brand, another product, another drug that is called carbagoline. And the brand that I personally like is what we call Sinego. Okay, Sinego contains 0.5 milligram of carbagoline. It is used for the treatment of this hyperprolactinemia that we're talking about. The good part about Sinego, side effect is lesser, and its pill burden, it's reduced. In other words, like bromocriptine that you take like twice in a day, Sinego you take it twice in a week. 0.5 milligram twice in a week. It's not every day. So for people that don't like taking pills, for people like me that don't like taking pills, you can decide to take like today, and 4 days after you take another dose, and you take it for the period of 3 months. I tell you, you'll be okay by then. That is Sinego for you, and you can see it to buy in any pharmaceutical store around you. But like I said, this ailment requires you to first, when you notice all these symptoms I discussed about earlier, please visit your doctor. Let your doctor know what you're feeling, how you're feeling. Let the doctor know so that he'll be able to know the kind of treatment that is best fits you. Like I said, I only discussed 2 out of options that are available for treating this hyperprolactinemia, and 2, which is, like mentioned, the drugs. Number 1 is bromocriptine. I tell you that personally, bromocriptine is crazy, the side effect. And number 2 is Sinego. Sinego contains 0.5 milligram of carbagoline, which it's effective. The side effect is minimal, and the pill burden is reduced. You don't have to think of, oh, I'm not taking my drug, or you don't have to think, it's just 0.5 milligram twice a week. It's 0.5 milligram twice a week. If you take today, 4 days after that day, you take again. That is how it works. Okay. I hope you find this video interesting. I hope it helped you to really know what is wrong with your body system, especially for a young lady out there. You're feeling you're having infertility. There's possibility that this hyperprolactinemia might be one of the things that is causing your issue. So I advise you to locate your doctor and let your doctor know the symptoms you are having. And thank you for watching. Till I see you again. Bye.